Well, hello everybody. We are live and I am Christina Jordan, Master Nutritionist here at Fit Body Weight Loss.
And I'm Dr. Herman Solorzano, internal medicine.
And I'm so excited because I just said, hey, let's go live and share some really cool, exciting, awesome news. But before we begin, first of all, I have a little gift for you.
Oh.
Oh!
I like gifts.
For those of you who may be watching live, I'm on the cover right now. If you go to any store across America, from Target to Walmart to the grocery store, right now you can find Women's World magazine and I'm on it. And guess what? I have a copy for you.
Perfect.
And I'm totally signing it for you.
I'm going to keep it in my office. Maybe I'll frame it.
There you go. So now you have your own copy.
That's awesome.
Signed issue.
Look at this.
I know. He's totally got it. I totally signed it. I know, it's so crazy. But for those of you who maybe are watching and you're like, well, why are you on that magazine, Christina? Well, because I've lost half my body size.
Unbelievable.
I've lost 134 pounds and I've reversed type 2 diabetes, which do you see that often in your industry? Because you're an MD.
Yeah, absolutely. I mean, that's the goal and people sometimes don't know. They don't know that how important nutrition is.
I know.
That it could reverse type 2 diabetes.
Absolutely.
Yeah.
And this is what's so cool. I'm sharing this because I'm going to put him on the spot right now. I'm totally putting you on the spot.
Yeah, I love it.
He's like, oh!
I'm ready.
He's actually on my program.
Yes.
And you want to share, he's lost a ton of inches. This is his 1 month check-in.
1 month.
And in 1 month, you've lost
17 pounds.
17 pounds. That's high five. That's awesome. And and you've been busy, haven't you?
Very busy.
Life has been going and you're busy and you're running all over the country and leaving, you're globetrotting, doing all kinds of stuff.
I'm not as busy as you, but I
don't know about that. So you've been crazy busy and you've still done an awesome job.
Thank you.
And we're going to do even better this month, huh?
Absolutely.
And I have it on camera now.
I'm excited.
So literally, I'm proud of you.
Thank you so much.
You've done amazing because a lot of times, people think, especially in your position, people who are MDs and doctors like you, it's hard to ask for help.
Right.
When you're already the expert in your industry.
Absolutely. Absolutely. And I feel like in medicine, one of the most important things about public health is public health awareness with nutrition.
Right.
A lot of people, you hear some of the social workers and some of the doctors bring in these pamphlets of nutrition, but
they don't know what it means.
They don't know what it means.
They don't follow it.
No,
they don't even know. I mean, I cannot tell you, majority of my patients here at the clinic are nurses and doctors.
Unbelievable.
It's crazy. I see at least 6 nurses a day.
Wow.
They'll come in and every other patient is, standard civilian nurse. It's crazy.
Wow.
And they know what to do, but they're so busy that it's really difficult to put it all together. And especially if the busyness then creates a hormone imbalance.
Oh, wow.
Which that's what stress does.
Yeah.
So you believe this so much. Now this is the big news we have to share. And I'm going to let you talk on this one because I've done a lot of the talking. But
absolutely.
I'm so honored by some big news that we're about to share, and I'm going to let the doctor share. So you want to share what we're doing?
Yeah, with the medical students?
Yes.
Absolutely.
Yes.
Yeah. So part of the curriculum for 3rd and 4th year medical students has been nutrition. Nutrition is a very important rotation that students have to be exposed to. So we are partnering up with Ms. Christina Jordan here to
I'm so excited.
To be a medical provider attending to our medical students. There are 3rd year and 4th year MD students here in our Abrazo network and Mount Vista Hospital network.
That's exciting.
So
and it's through the Hyatt Healthcare system.
Yeah, through Hyatt Health, absolutely.
Through Hyatt Health. And so basically what this means, so you're telling me that I get to actually help create and educate programs for our next generation of doctors.
Huge component for the medical study. And
you know what? That is so exciting.
Yeah, very exciting.
Thank you for that. Thank you for inviting me to do that. And yes, the answer is absolutely. I'm so excited.
It's going to be a blessing for our medical students to be here, a part of
I think we're going to so they're going to come in and they're going to intern here and we're going to go live with them sometimes if they want to.
That would be awesome.
They'll love it. They're going to help with all the participants on my TV show.
Yeah, maybe they could come with you to the TV show.
Yeah, well, we film all around and they always meet here and then we head off to wherever we're going to film.
Wow.
So they're going to get
experience.
they're going to get such an experience.
Yeah.
It's going to be a really awesome thing. So what that means is hopefully over the next few years, I get messages all the time where my patients will say, I wish my doctor understood nutrition like you do.
Whoa, how big
We're
is
fixing
that?
this.
Wow.
We're
wow.
fixing a major problem.
Huge
where
problem.
even our doctors need to understand that we can heal things with food too, in combination. I'm total about integrating this. Holistic but realistic.
Right.
Integrating both worlds.
They have to go hand in hand.
It really does.
Yeah, for the right plan, plan of action. So this is awesome.
It is so awesome. So for those of you who are interested in learning more, do you want to share your website?
Yeah, you can go to www.hyatt-health.com.
So hyatt-health.com. What's your social media tags?
Hyatt Health and then Hyatt Clinical Education.
And you want to share your full name so that way they could find you as well?
Yeah.
And I did tag him as well.
Dr. Herman Hyatt Solorzano.
Okay, and if you're interested in learning more about what we're doing here, and I'm going to document all this, you all know I will. It's fitbodyweightloss.com, and you can find us on Instagram at fitbodyweightloss or on Facebook at fitbodyweightloss. But this is seriously one of the coolest things I think I've ever announced.
Oh my gosh, that's all awesome.
This is like it's really exciting, and I think it's so cool that you're open to learning about nutrition and learning how it affects the body and how it can save lives.
Absolutely.
It really can.
Absolutely.
Because nutrition can heal you or kill you.
True. Absolutely. Absolutely. And when when a patient really truly embeds it in their life and their daily, you see the results. You see what they do. So
it's true. Now I have some questions for you,
yeah.
which I know because people have already sent me questions in, and I said, okay, I'll ask whenever I talk with him. Do you feel that diabetes is reversible as a doctor yourself? Do you feel it's reversible?
Yes. Yeah.
Type 2.
Type 2. Absolutely.
2.
Absolutely.
We're not talking type 1, so we're talking type 2.
Type 2. Yes. With the right. So one of the best experiences I had with my training, I trained with a pediatrician here in town, and she's of Chinese descent, and so she's really into holistic and Chinese medicine.
What a good experience for you.
Yeah, it was
that's
unbelievable.
very rare you'll get that.
Yeah, Dr. Lim, and she showed us cases where type 2 diabetes was reversed with only nutrition.
Exactly.
Not pills, not a treatment plan, except for the person's nutrition.
Right.
And she talks about it in her lectures at the Children's Hospital here in Phoenix.
That's amazing.
Yeah.
So you heard it from the mouth of a doctor. And I reversed it, right?
Yeah, absolutely.
I had diabetes for 4 years almost.
Unbelievable.
On metformin, I was taking insulin, totally reversed, 10 years set free, haven't touched insulin, haven't had a metformin, nothing.
Is that in here?
We're talking about my thyroid in this one. I was on Synthroid for the same amount of time, about 4 years. Because when I got sick, all the bad choices caught up to me, and I got very sick. I literally I saw a dozen different doctors, and they were telling me, well, you obviously need to lose weight. I know. And I was doing what they were telling me to do. I was eating less, working out more. I gained 22 pounds of fat that year. Eating less, working out more. And honestly, it's not always about eating less. Just like I've told you, it's about eating more. It's about eating quality.
Yeah.
And when you're eating real food and healthy food, you don't have to count calories.
No. In fact, you feel more energetic, and that's what's helped me.
Now, have you felt at all energetic? I know
Yes.
you've been traveling a lot. You've had some family things go on. Have you got to experience that at all yet?
I have.
In your own journey?
I have, absolutely. It's been such a blessing to be a part of this and having met you. And so to be able to...
I'm glad to be your nutritionist.
Yeah. So very thankful, truly.
How about your digestion? How's that feeling?
Oh, fantastic. Wonderful.
Are you sleeping at all better?
I'm getting my 8 hours every day.
And I guess that's progress from where we started, wasn't it? Because you were doing about 6, I think.
Less than that.
Wow, you're
4 to 5 hours.
Well, and honestly, this isn't a sprint; it's a journey, and you'll continue getting better. You'll be eating even better, and it's all stepping stones. And you're going to keep progressing, and I can't wait because you're going to be a light to all those doctors.
I hope so.
Those hundreds,
absolutely.
And he works with hundreds of doctors, you guys. He's the leader of them. He trains all these new doctors coming up all over, and you have You train here in Arizona, in Phoenix,
in Tucson,
and in Texas,
San Antonio, and Houston.
And look at that, he's all over.
Yeah,
all over. And do you have a clinic down in Tucson
yes,
as well?
Yeah, we have right now it's in development, but we're affiliated with over 45 clinics down in Tucson.
Wow, you guys,
5 hospitals.
That's amazing.
Yeah.
And look at what you're bringing. You are opening. What it is he's opened Pandora's box now. And once you go back, like once you go in, there's no going back. Like you're gonna see how you change without a single pill.
Absolutely, absolutely. I'm already seeing it.
I know.
I'm on that journey.
17 pounds without anything but making these positive changes, balancing out your hormones. And there's nothing wrong with you guys. If you're dealing with stress, we got to get those stress hormones down.
Yeah.
That's a big part of the journey.
Yeah.
Are you still making daily progress on lowering your stress levels?
Absolutely, absolutely. It's something that I have to practice what I preach.
I
talk to people in my medical
I
students.
have to make sure I drink. If I tell you to drink a gallon of water, I got to drink a gallon of water, and that's the hardest thing to do.
But stress is a big indicator. It's tied into many diseases that we encounter every week. So it's important to regulate it, maintain it, lower it.
So one last, I'm gonna let you close, and if you can offer, because we're gonna post this all over.
Sure.
This is gonna go to YouTube. It's gonna go to Instagram. It's gonna go to Facebook. Yeah. And if there are other medical providers watching, do you have any wisdom for them?
Yeah.
Maybe a word of encouragement to offer them?
Absolutely. I think the number one thing is to look at your life as a panorama, where you see there's sunshine, there's clouds, there's things that, they may not make sense now, but there's a purpose to it. And I think with tribulations comes a lot of learning about yourself, your journey, and you have to take it with a grain of salt, embrace the rain, be able to embrace the thunder, because in itself you enjoy the rain. Right. So tied in with stress is to really don't take life easier, and do not focus on the bad things.
Yeah, that's a great idea. Yeah. That's really good. And honestly, you guys, I think he's such a great example, because you're not just saying, oh, we need to do this. You're doing this, and you're admitting that some days it's easy, some days it's hard, some days you mess up, and I love that you're working on you, and you're not just everybody else needs fixed, not me. No, you're like, I'm here and I need some help, and I'm changing.
Every day. And
you're doing so much for this world. You gotta also do and take care of you too.
I'm trying to get to your level.
Oh my gosh. I'm gonna train you, and my goal is to get your doctors where they can help impact these lives in such a positive way, where maybe we'll see a drop in thyroid issues, in diabetes, in digestive problems, in these unexplained chronic issues that are chronic, and it's from the food that they're eating.
Wow.
This is bigger. I think this is so much bigger than probably we're even letting on, but it's awesome, and thank you for going live.
Thank you so much for this
time. Check him out. I tagged him in this, and if you have questions, let me know. If you want to learn more about what he's doing, I have him on the Forever Fit Elite program right now that I do here, and we're working on stress levels. We're lowering stress. We're balancing out hormones. We're making sure his insulin stays level all naturally. And we're also have him on an eating plan where he's eating more than he's ever eaten before. Am I starving you at all?
No, it felt like that at first, but now it feels pretty good.
Yep.
Pretty normal.
Yep. And he's making these positive changes that he's sharing with his whole family. And
absolutely, everyone
can do this. It is all ages, all busyness, all levels. So check it out at fitbodyweightloss.com, and let us know if you have any questions. And we will be sharing more in the future. So you
Looking
guys,
forward to it.
Yes, thank you.
Thank
Good
you so
job.
much.
Bye, you guys. Have an awesome day.